Scientific debate will be stifled, and doctors who disagree will be disciplined and disbarred from the medical board. Hello and welcome to Sweet Home California. My name is Jennifer, and I am referring to California Bill AB2098. It is scheduled to come for vote out of the committee on April 7th, and the People's Convoy is moving out of DC, where they've been for the last 3 or so weeks, and they are driving back to California to bring attention to this bill as well as 9 others that they have deemed to be a danger to our medical freedoms, not just in California, but in the entire United States, because unfortunately, normally, so goes California, so goes the rest of the nation. Let me read to you the text of this bill. So this was introduced by Member Lowe, and co-authors are Aguilar Curry, Keila Weber, and Wicks. Co-authors Senators Pan and Weiner. And this is from February 14th, 2022. This is going to add Section 2270 to the Business and Professional Code relating to the healing arts. The Legislative Council Digest, AB 2098, as introduced by Lowe, Physicians and Surgeons, and it's about unprofessional conduct. It says, existing law provides for the licensure and regulation of physicians and surgeons by the Medical Board of California and the Osteopathic Medical Board of California. Existing law requires the applicable board to take action against any licensed physician and surgeon who is charged with unprofessional conduct as provided. This bill would designate the dissemination or promotion of misinformation or disinformation related to the SARS-CoV-2 coronavirus or COVID-19 as unprofessional conduct. The bill would require the board to consider specified factors prior to bringing a disciplinary action against a physician and surgeon. The bill would also make findings and declarations in this regard. So this is just a majority vote. It says that there are no appropriations for it. Apparently it has to go through a fiscal committee, and there is no local program. So this is more details on that bill here. It says the people of the state of California do enact as follows. Section 1. The legislature finds and declares all of the following. A. The global spread of SARS-CoV-2 coronavirus or COVID-19 has claimed the lives of over 5 million people worldwide, including nearly 75,000 Californians. The data from the Federal Centers of Disease Control and Prevention, CDC, shows that unvaccinated individuals are at risk of dying from COVID-19, that is 11 times greater than those who are fully vaccinated. The safety and efficacy of COVID-19 vaccines have been confirmed through evaluation by the Federal Food and Drug Administration, the FDA, and the vaccines continue to undergo intensive safety monitoring by the CDC. D. The spread of misinformation and disinformation about the COVID-19 vaccines has weakened public confidence and places lives at serious risk. E. Major news outlets have reported that some of the most dangerous propagators of inaccurate information regarding COVID-19 vaccines are licensed healthcare professionals. F. The Federation of State Medical Boards has released a statement warning that physicians who engage in the dissemination of COVID-19 vaccine misinformation or disinformation risk losing their medical license, and that physicians have a duty to provide their patients with accurate, science-based information. G. In House Resolution number 74 of the 2021-22 regular session, the California State Assembly declared health misinformation to be a public health crisis and urged the state of California to commit to appropriately combating health misinformation and curbing the spread of falsehoods that threaten the health and safety of Californians. Section 2. Section 2270 is added to the Business and Professions Code to read, A. It shall constitute unprofessional conduct for a physician and surgeon to disseminate or promote misinformation or disinformation related to COVID-19, including false or misleading information regarding the nature and risks of the virus, its prevention and treatment, and the development, safety, and effectiveness of COVID-19 vaccines. B. The board shall consider the following factors prior to bringing a disciplinary action against a licensee under this section. 1. Whether the licensee deviated from the applicable standard of care. 2. whether the licensee intended to mislead or acted with malicious intent. 3. Whether the misinformation or disinformation was demonstrated to have resulted in an individual declining opportunities for COVID-19 prevention or treatment that was not justified by the individual's medical history or condition. 4. Whether the misinformation or disinformation was contradicted by contemporary scientific consensus to an extent where its dissemination whether it results in gross negligence by the licensee. For Section C, for purposes of this section, the following definitions shall apply. 1. Physician and surgeon means person licensed by the Medical Board of California or the Osteopathic Medical Board of California under Chapter 5, commencing with Section 2000. Board means the Medical Board of California or the Osteopathic Medical Board of California as applicable. And then it says D, Section 2314 shall not apply to this section. Well, I am not going to commentate on that here on YouTube, but I will continue on over on Rumble and Locals. So if you'd like to hear what I have to say on that, then go on over there. But otherwise, that's it for YouTube.